everyone. We're going to go ahead and get started. Welcome to our Webinar Wednesday kickoff. This is going to be the first of a series of webinars that we have regarding the programs in the Health Management and Informatics department. Today, we're just going to do an overview of our two undergraduate programs. There's going to be some great information, and we're going to hear from a lot of our panelists so you can get some more information about our career fields, our programs, and the different attributes that we've got. We're going to start out with introductions, of course. At the end, we're going to have a Q&A. There will be some questions that we've already prepared, but also please use the chat function, and you can send your questions directly to me or to everyone, and we can address them at the end of the presentation. So as you have those questions, you can go ahead and put them in there. All right, we're going to start out first giving you the basic information about the undergraduate programs, where we're located, and the overall people. I'm going to kick off the introductions. I want to go ahead and first start out with our program director for our Health Informatics and Information Management undergraduate program, Alice Melvin. Alice, go ahead.
I'm sorry. Hi, I'm Alice Novlin. I'm the program director for our undergraduate Health Informatics and Information Management program. I am housed downtown, and I look forward to serving you and giving you some more information today. Please feel free to reach out later if you have any questions.
Thank you, Alice. The next program director we're going to introduce is Mark Bush. Mark, go ahead and introduce yourself.
Hi, I'm Mark Bush. I'm been with UCF for about 4 years. Prior to that, I was in hospital administration. I was the CEO, CFO of hospitals, and I have about 26 years experience in healthcare overall, and look forward to talking with you today and telling you about our exciting program and the exciting people we have involved in it. So this should be a good session for everyone.
Thank you, Mark, and welcome to the panel. And next, I'm going to move on to Ms. Amanda Walden.
Hi, I'm Amanda Walden. I'm one of the instructors in the HIAM program, and I also teach courses over in the HSA that cross over as well. So if you end up taking either of these majors or even one of our minors, you'll probably end up having me as one of your teachers.
Thank you, Amanda, and welcome. Thanks for being here today. All right, we're going to move on to some of the other presenters. The other moderator that's here with me is Thea Samaki. Thea, go ahead and introduce yourself.
Hi, I'm Thea Samaki. I am the undergraduate Health Informatics and Information Management Program Coordinator. So I'd be assisting with any scheduling questions that you may have throughout the program, and we'll work with you to complete the program.
Thank you, Thea. Of course, then we have our internship coordinator, Ms. Jackie Gonzalez. Jackie, go ahead and introduce yourself.
Hi, everyone. I'm Jackie Gonzalez. I'm the internship coordinator for the Health Service Administration program, and I look forward to meeting all of you, and I look forward to a helpful session.
Thank you, Jackie. And last but certainly not least, my name is Katie Terry. I'm one of the program coordinators in the Health Informatics program, in the Health Management and Informatics department. I'm going to be one of your moderators today and throughout the rest of the webinar series as we go through. Welcome. Thank you for joining us, and all of you that are watching on YouTube Live. I hope we get you some good information. All right, let's hit the ground running, and we're going to go ahead and start with the Health Service Administration. Mark, I'm going to kick it off to you.
Perfect. Thank you. Again, a lot of people ask, what is Health Service Administration degree? It's really the business side of healthcare. And so we give you a curriculum and a set of classes that will help you run hospitals, healthcare organizations, long-term care facilities, and others. Again, we look at the business aspects. We try to help you understand the business side of running hospitals and taking care of the employees and the patients. Skills that we develop, of course, are your critical thinking, communication, which is a big part of what you do every day, healthcare information analysis, and leadership. And again, really what our degree is about is preparing future healthcare leaders and managers in running efficient healthcare organizations and impacting the community's health outcomes. So we're here for you. One of the great things about this degree is there's a lot of growth potential in it. And you can see that from the graph that is there, the projected employment. And again, as new things happen and things evolve, which I'll be talking about a little bit later, that will have a big impact on what potential careers there are in the future. A lot of people will have the opportunity to be in this, get this degree and then have a different type of job than even exists today. So that's the other exciting part about the degree and about the industry that we're in. Ours is an open access, so you can join our program. There's no real process other than to declare it as a major. And so we welcome you to our program. We get a lot of people from nursing, preclinical, who decide they don't really want to put hands on patients, but they still want to be involved in healthcare. And that's what we are here to do. And you get involved in the community and changing things and helping communities be healthier and stronger. I really have three highlights about our program, and these are the three things that I think that are awesome about our program. One is our program, we are focused on student success. We want you to complete the degree. We want you to complete it timely. If you look on the right-hand side of this graph, you see two pictures of both Katie and Pam. They are the program coordinators, and they're the ones who make it a efficient process and an expeditious process. Since we've been together as a team, we've been able to cut a half a year off of the time to graduation from where we were 3 years ago. And that's because we work hard with the students to make sure that they're taking the classes in the right order and that we're helping them any way we can so that we can make sure they get through this process and get this degree as quickly as they possibly can. The other part of our organization I think is outstanding is some of the people on the left-hand side. We have 30 people in our department that are faculty, and they do an outstanding job for us. A lot of those people have both a mix of professional and academic achievements. We have former CEOs and CFOs. The gentleman up on the left-hand corner was a CEO for Orlando Health. Our program, or our department director, is the young lady who's next to him, Dr. Sui Ho. She's our program chair. And then we have two people on the bottom who have experience and academic experience that are a part of our program as well as, and you'll talk with Alice and Amanda today, who are also in our program. We have a Fulbright scholar who's very research oriented and done some great work and is actually hoping that this travel bans will change and she's able to travel to finish up her scholarship that she's received. And the other thing that we have is we have great student organizations and great ability to work with our students. We have a on-campus HSA student organization, as well as we have the local chapter of ACHE. And if you're not located in Orlando, there's other chapters throughout the state of Florida and throughout the United States. It's really important that you belong to these types of organizations, as they're going to be your springboard into the field and into a career in health administration. Where can I work with this degree? Again, I mentioned this a little bit before. I worked in a healthcare system. I worked for hospitals, and I was a senior vice president in charge of the long-term care facilities as well for our healthcare system, also regional dialysis. And you can work in continuing care, retirement communities, physician offices, home health, rehab facilities, outpatient clinics, insurance industry, and consulting. And again, this can be a springboard into future degrees, getting a master's degree in health administration as well, which will also help you move up the career ladder as you go forward. And we have great programs in that as well. The next thing we're going to talk about is what do health administrators do, especially in this global pandemic that we have. A lot of it is coordination of staff, facilities, community, trying to get people to work together. Every day you're monitoring what are your resources that you have, what resources are available, and what resources do you need? How do you get those resources? If you're part of a larger healthcare system, you're looking at how do you allocate resources between facilities, between organizations and types of businesses, because a lot of systems have physicians who are in physician practices, and they can bring them into the hospital if they need to help with treating patients. It's working with the local community partners, as well as even some of your competitors in these situations. When there's a pandemic, you're trying to take care of the entire community, working with everyone involved in that process, with your local health departments, with city officials, with physicians as well. And again, it's a massive coordination effort that most people are going through. The other piece to this is they're managing and identifying how are they going to survive financially through this process, because it's having a huge impact on their financial outcome as well. With the reduction of with elective surgeries and procedures, that's having an impact on the overall cash flows, and they're having to manage that as well. And so this is an interesting time, and interesting things that have evolved. Some of the great things that are happening is telehealth is exploding as a new area of treatment for patients. And I think this will be something that will be a huge plus for patients to have access and be able to get the care that they need in a whole different manner than what they were used to prior to the pandemic. And so those are just some of the things that are going on. A quick overview with a person that's in healthcare administration, some of the things they're working on an everyday basis. So with that, I'm going to turn it over to Dr. Noblin, who's going to take over the health information and informatics side of this.
So I'm actually going to pop in and talk a little bit about HIIM and COVID. So since we just talked about how HSA has been impacted by the pandemic, I'm going to talk a little bit about the other side of the other major that we're discussing here, HIIM. So the field of HIIM has been impacted in many ways by COVID. Our field is diverse and includes many aspects that have been at the forefront of fighting this pandemic. One area of note that was just mentioned is that of telehealth initiatives. Telehealth as a concept has been around for many years, but we've seen an explosion in its usage over the last few months. HIIM plays a key role in telehealth as we ensure that the patient data is exchanged securely so that patients feel comfortable utilizing these distance services. HIIM professionals are also at the forefront of collecting and reporting on data during the pandemic. Our industry fast-tracked creation of new reporting codes so that we could identify and track patients with a COVID diagnosis, and so that facilities could be reimbursed appropriately as this disease utilizes heavy resources. These medical codes are used for continuity of care. They provide researchers with specific information about comorbidities and treatments that COVID patients experience. Over time, this information will be crucial in determining the best way to tackle the virus. And the last area that I'll mention has to do with data capture. HIIM professionals help create and maintain database systems, including electronic health records. We saw many instances, especially in New York, of the creation of pop-up hospitals or overflow beds in areas outside the main healthcare building. In order to treat these patients, HIIM professionals had to add new bed locations or facilities to existing systems so we would know where the patients are and that we could provide the appropriate care. They had to ensure that the information was flowing between facilities and organizations in order to direct resources to areas in need. And I'm going to go ahead and then turn it over to our program director, Dr. Noblin, to tell you more about our major in specific.
Thank you, Dr. Walden. I think that's a great kind of segue into our degree program. I'm going to kind of back up and start at the nuts and bolts part and kind of give you an idea of what is health information management and health informatics. And the first thing we need to think about is the actual clinical information that is collected on patients. That's the data that we've kind of been alluding to here. So any patient history information, lab results, chest x-rays, any notes or clinical information is kept in the health record. And that's part of what we oversee. And as I mentioned here on the slide, it's the legal health record of a patient's clinical stay at a facility. So the patient's health information can be viewed individually to see how a patient progresses over time with a disease process, or health information can be viewed in a larger set of data in regards to how populations are reacting or how their health is changing based on medical interventions. Health information management is the actual practice of acquiring, analyzing, and protecting all this information. HIIM incorporates disciplines of medicine, management, finance, information technology, and law into one curriculum. And so that gives you a lot of opportunities for jobs or career paths down the line because of this great variety of coursework that's included in the degree program. Next slide. The HIIM program at UCF has been here since the 70s. And that means that we have a lot of dedicated graduates in Central Florida, throughout the state, and actually nationally. And those graduates are willing to mentor, train, and hire our graduates. Upon graduation, most students have earned the Certified Coding Associate credential to get a head start on job opportunities. We also prepare our students upon graduation to take the Registered Health Information Administrator examination. Our program is accredited by CAHIM, and accreditation means that we undergo rigorous evaluation annually to make sure that our program meets the standards from this accrediting body. Next slide. So when we think of some highlights in the program, I like to kind of focus on the different experiences that we provide our students. We offer a variety of internship experiences to introduce students to healthcare settings, both virtually and on site. These include tours of hospitals, hands-on experience with a physician practice management software system, and a traditional internship at the end of the program that could be in a facility that's convenient to your hometown. Also, our faculty have extensive work experience as well as good professional connections in the HIM industry. Next slide. HIM professionals work in a variety of settings and have a variety of job titles. They often serve in roles that connect clinical, professional, operational, and administrative functions. HIM is not at the bedside, as Dr. Bush alluded to, but we do care for patients by caring for their health data. And now Ms. Jackie Gonzalez will tell you more about the internships and networking for both of our programs.
Hey everyone. So the question I get a lot is, so how do I get there? There's so much opportunity in the healthcare field that sometimes it's a bit difficult to figure out exactly where you want to be. So thankfully, at the end of each of these programs, you have an internship experience. So this experience will help you gain great skills. It'll help you build a network, and it'll also help you put all that theoretical things you've learned in the classroom into actual practice in the work field. That's what a high level of what the internship experience is. It's definitely a good time to be in healthcare, guys. Some other opportunities and steps that you can take to getting where you want to be is networking and different organizations. In Health Service Administration, we have the HSA Student Association, as well as Epsilon Phi Delta, which is the Honor Society. And as Dr. Bush mentioned earlier today, the American College of Healthcare Executives. This will really help you on your next step to being a professional in the healthcare field. I'm going to hand it over to Thea to talk about the health informatics and information management organizations.
Hi, so some of the organizations that we tell our students to get involved with, there's a few different ones. One is, of course, our national organization, which is called the American Health Information Management Association, or AHIMA. Becoming a member of the national organization automatically makes you a member of the component state organization, which for us in Florida, it's a Florida Health Information Management Association. Students can also consider joining their regional organization. We're here in Orlando. Ours is the Central Florida Health Information Management Association. But if you live somewhere else in the state of Florida, you will likely be in a different region. So you can look that up through the FHIMA website. Another organization that we also like our students to be involved with is our student organization called Student Health Information Management Association. So as you can see, there's a little bit of a trend in the naming of our organizations, and we do like to abbreviate most of them. So
I've definitely learned there's so many abbreviations in healthcare. Oh yes, definitely. So some major organizations that we have affiliations with in the Central Florida area and outside of the Central Florida area. But these are the major ones in the Central Florida area: the Advent Health, Orlando Health, the VA, HCA, Orlando Health First. There's many more organizations. The list has grown exponentially, and that's absolutely wonderful. We have over 400 different affiliations with different partners, and they're wonderful. And it's one of those things where you're paired up with a preceptor, so you'll be guided pretty much through your internship program. And it's really great because you can put this on your resume. You can definitely solidify exactly what you want to do in the healthcare field. And it's one of those things where it's just a great opportunity. So some examples of projects that you can look forward to at the end of your program. I've seen students do strategic planning projects, figuring out where a new practice or a location can be, and implementing new processes or improving upon a process, finding a new way of evaluating things. Decreasing wait times is always a big one. Increasing patient volume through marketing. I've also seen students create a whole new, this semester actually, creating a whole new system on how to onboard new employees, because with COVID going on, everything is completely pivoted. So this intern pretty much took that and put this whole process across the board. And it's so great that now they're putting it not only in that practice, but all the other practices that the organization has. Some projects I've seen in health oh my gosh, I can never say this, health information informatics management. And my colleague, Mr. Tan, is usually the one that speaks about these, and he has much more expertise on that. But EHR transitions to Epic, business intelligence projects, because data is very important in this day and age. Privacy and security things, these are huge, guys. It's definitely a good time to be in healthcare because all these things are essential, and at the end of the day, they make a huge impact on patients.
Thank you, Jackie, for going over the internship section. All right, I'm going to go kick it back over to Dr. Noblin, and she's going to talk about some of the minors, because while the healthcare administration and health informatics programs are great for our, as a major, we also have a lot of students who end up with a different major that this becomes a really great skill to pay the bills. Alice?
Thanks, Katie. Yes, we have minors to increase your knowledge base and provide skills for the workplace. Minor selection should be done intentionally to enhance your career prospects. So as you can imagine, many majors can pair with our minors, including business, finance, psychology, biomed, et cetera, that are listed along the bottom of this slide. As the top says, there are skills to pay the bills. Medical coding is included in the second and third minors, and more administrative management type coursework is included in the health services administration minor. So any of these pair nicely with a lot of different majors, and you just need to really kind of think about what kind of a career you might want to, how you might want to expand your career options. But again, we're here to help you with these. There's good crossover between these and our majors, kind of hint, hint. If you wanted to get HSA major and one of the HIM minors or vice versa, that's not uncommon that our students would do that. So there's a lot of different options with minors, but they should be done intentionally so that you can actually benefit from them the most as you enter the job field.
Thank you, Alice. That's a very, very good point. Those minors should be done intentionally, especially because they can be so lucrative for you. So that's the end of our formal presentation. We're going to open up to Q&A right now. We'll jump to the questions. I'm going to present the questions to our panelists and let them answer as a piece. You can utilize the chat function if a question comes up. Just type it in the chat function to everyone, and I will present it to them as they come through. Okay? So our first question comes from one of our participants. How do you choose whether the health informatics major or the health services administration major is a better fit for you? Let's start with Alice.
Well, what I always tell students, kind of to think about what it is you hope to do. And there is crossover between our majors. So the curricula, HIM has about 5 HSA courses in it. HSA, I believe, has 2 or 3 of our required courses in their curriculum. So it is a matter of looking at the actual coursework and also considering the prerequisites. When you think of HIIM, we are a little bit more clinically oriented, and anatomy and physiology are prereqs for our. So you will you will have to take medical coding classes, and medical coding is not the same as computer coding, but there's 3 courses in our curriculum specifically for medical coding. And a lot of that anatomy and physiology is needed so that you'll understand the codes and you'll understand the contents of a health record. So it's a little bit more clinically oriented to get the HIM major. And I'll let Dr. Bush describe maybe his outlook on this.
Well, I think Thea in the chat gave a great answer as well. She said that it really depends on what your career goals are. Do you want to work more on the records side of things, keeping track of data and data management, or do you want to work more on the people side of things? Now, don't get me wrong, HIM, you have to deal with people, doctors, nurses, and everyone in that role. But one is more of the management business operations. The other is more of a specific detailed data analysis, data information management compared. So you have to look at what your skill sets are and what kinds of positions you would really like to pursue in your future. And again, both have great minors to complement each other. A lot of our majors get the HIM minor, and I know some of the HIM majors get our minor as well. So they kind of complement each other well, but it really depends on what your goals are and what career opportunities you're looking for. And so those are the things I think you'll want to look at. And we'll have a question later on that I'm sure we're going to talk about what's exciting in the future of both of these fields. And we talked a little bit about that with the telehealth explosion and some of the data security issues that are going on. So I think you'll get a sense for it when we hit those areas. Then you'll have to decide which is interesting to me and what is it I want to do. The one thing I have to say to you is get the degree. That's the most important thing. And if you decide after a while you want to change to another major, go back to school. I've had 3 careers in my life. Each time I've changed my career, I changed it by going back to school and getting another degree. So I have an undergraduate degree in management, a graduate degree in MBA with finance focus, and then I have a doctorate degree in health administration. And so each time I've changed my career, I've gone back to school to pursue that. And to me, getting the degree and getting the education is the most important part. And finding that career opportunity, it'll come to you over time.
Thank you, Mark. So we have another question from a participant. They are currently a nursing major. Do students switching majors have a difficult time making this transition? So I'll go ahead and address this one as a program coordinator because I get this all the time. And I can honestly and truly tell you that there is not a difficult transition between those degrees. The fortunate part is that you'll have a basis, having come from a nursing degree, coming over to the health services, and you're moving from clinical into the administrative side of things, or the administration side of things. It's more of a benefit to many students who come over either to get our minor or to get our major from the clinical aspect, because they all now have the information of both worlds. So if you are working in the office setting as an administrator and you need to speak with a nurse or a doctor or understand a chart, you already have that basis for that knowledge. And the same goes for the health informatics and information management program coming from a clinical degree. Because you already have that clinical knowledge that you've been addressing, it's only going to help you coming into one of our programs.
The other thing I'd like to touch on is some of the prerequisites that you have in nursing do not line up exactly with all of ours, but we do substitutions for some of them. And one of them, for example, is a stats class. We require one stats class. You usually take a different one in nursing, but we will accept that coming over. So again, we're trying to work with you as a student who's moving from one degree to the other to try and get through the programs. Both of our programs do that to try and help you as much as we can.
Thank you, Mark. Our next question is, what is the starting salary for someone with a degree in HSA versus someone with a degree in HIM?
I would say that it's pretty comparable.
I would agree.
So somewhere between $30,000 and $40,000 will probably be your start. Depending on where you start out in the organization and what level of experience you have and what you've done through your internships and other processes of making contacts and the types of positions that you're looking for.
I will just add in there are some really cool resources that the university offers. You can actually look on our statistics website and it'll show you not only our job placement rate after graduation for our programs, but also the average salaries of students who go into the field entry level. So that's another place to look. And then of course, always the Bureau of Labor Statistics can give you a really good idea of what those look like. But as Mark said, it's pretty comparable and on the rise because again, the health administration, health informatics fields are booming right now.
And I'd like to add one other thing too, that the credentials that you can earn within the HIM program program, the CCA credential that I've mentioned, you can actually earn that as a result of your minor work if you choose the minor. But the RHIA, you do have to have the major. You have to complete the major to be able to sit for that exam. But having that credential opens some doors that may not be open without a credential like that. So that might actually, give you some higher income opportunities. Although right out of school without any experience, you're not going to jump into a high level management position. You sort of do have to work your way up. So the salary information that Dr. Bush mentioned is it's comparable for HIM and HSA, but the credentials might make a difference and open some doors.
Thank you, Alice. Okay, so we have another question. We're going to kick it back over to Dr. Bush. What advice would you give a student who's interested in the HSA major?
This advice I give to any student in any major, but really for ours, what I think it's really important is when you graduate from college, you're going to be one of thousands of people looking for a position. And so what you need to do is start developing that network the day you start college, talking with people who are in the field that you're interested in, build a network of professionals, build a network of the professors you talk with and have as your instructors early in your college career, and continue to foster those relationships because it's really about that network that's going to help you get your resume from a stack of 1,000 to one that gets actually an interview in the organization. And the way you do that is by building networks and opportunities. The other thing is join some of these organizations that we've talked about for both of our programs. In our program, I think it's really important that you join ACHE, American College of Healthcare Executives. We have a local chapter in the Orlando area that is outstanding. They have monthly events where you're bringing people in, speakers in, and you're having CEOs of local facilities talking and giving tours of their facility, as well as you're meeting other healthcare professionals. It's your chance to exchange your business card, get a business card, meet some people, make those contacts, and foster those relationships throughout your career. And the other thing I think is really important is that you start to volunteer in the healthcare setting, whether it's in a long-term care facility or it's in a hospital or it's somewhere else in one of the areas that you're interested in. You either volunteer or you intern. There's many opportunities where you can get a part-time job or intern with an organization, even if you're not in the internship process. We've had several people who have graduated with our degree who've done 2 or 3 internships. And again, you have to have one to graduate, but it's always good to get those experiences, make those contacts. And when you're interning in an organization, you're meeting a great deal of people working in a healthcare setting and who can help you later on in your career as you're trying to find that first opportunity. So it's all about building networks. It's not comfortable, but we're here to help you do that. And we're here to help you understand what the important aspects are to make that happen for you.
Thank you, Mark. Back to Alice. We're going to ask the same question. What advice would you give a student who's interested in the health informatics and information management degree?
Well, networking is an unbelievably important part of career success in our field. Even though we've talked a lot about the HIM field being more data oriented, that doesn't mean you don't interact with a lot of people within the different organizations. So we typically host at least one professional meeting for our field each year. And we invite students and we encourage students to interact. As I mentioned before, we have a lot of alumni in the area who are willing to mentor students. And having a mentor as you're in a program like ours is also helpful. We have mentors at the national level. We also have mentors at the state level. And then I mentioned even our regional professionals are willing to mentor students. So that's another great way to kind of improve your social capital, I guess you'd say, because a mentor is going to introduce you to other people in the industry to help you, maybe make that next step. So consider, all the opportunities that are available. I know Thea mentioned, the importance of joining our national organization, which gets membership to our state organization. And as I just said, both of those have mentor programs, but you have to sign up for them. They won't come and ask you to be, part of their program. You have to take the step to actually get into those types of programs. And it's a commitment. You can't request a mentor, get assigned a mentor, and then never do any, work to kind of keep connected to that mentor. So there's, it's a give and take. And our field is very networked oriented, our health informatics and information management. And so, kind of doing some of that legwork on your own is one of those things that really helps you in addition to the book knowledge that we'll give you as part of the program.
Thank you, Alice. We have another question. Is it easy to find volunteer opportunities or internships in these fields? I'll go ahead and take this one. So the short answer is typically yes. Hospitals and healthcare organizations are constantly looking for help. And especially if you're an eager person that says, I would really like to be a volunteer, do this, etc., they're always happy to do it. As Ms. Gonzalez mentioned earlier, our preceptors and our partners in internships are always eager to get our students because there's so much to do and so much to learn, and it is such a growing field. But I will give you the one caveat currently because of the pandemic. It's a little bit difficult just because they want everyone to be safe. There's still opportunities. They still have some that are open, but it's important to know just what's going on and how that can impact. But the volunteer opportunities are vast. And as Alice mentioned, there are mentorship opportunities. All you have to do is ask and someone can definitely show you the ropes.
And I was also going to add, Katie, with that, it's one of those things where you miss 100% of the shots you don't take, right? So it's one of those things where reach out for sure. That networking piece is very important. It's definitely changed in this day and age because of COVID, and LinkedIn is a wonderful place to go. And you can definitely talk to alumni, but I highly encourage you all to seek out those opportunities. You will find them.
Thank you, Jackie. Okay, I'm going to kick it back to you, Mark. What is currently happening in the healthcare field that will create new opportunities for students with the HSA major?
Well, I think there's a lot of exciting things that are happening. There's new systems and delivery systems being developed. You have the Walmart Health that is opening up and expanding. So there's a whole new delivery system and new approach to healthcare that's out there, where it's not driven by a hospital, it's driven by a private sector industry. You have the Minute Clinics of CVS and Aetna, who just merged together and are creating huge opportunities in healthcare there as well. If you believe Medicare for All is going to come within the next few years, that is going to be a huge explosion of how new jobs are going to be created. The way that CVS has developed their delivery system, their hope is that every Medicare Advantage patient will end up seeing one of their physicians or providers in a Minute Clinic, and they're usually located within minutes of most of their covered lives. And so I think this is going to be exciting. There's also a new organization called Haven that's out there that I think is potential for some real excitement as well. They are working on the employee health benefits side of things. They're a combination of Amazon, Chase, and Berkshire Hathaway, and they're looking for ways to save money for the employees that work for those organizations. The number of people that are available, the types of things and delivery processes that they're going to develop are going to be extraordinary, and they're going to be able to be transferred from not only their organization to other organizations throughout the country. And I think that's where, if you're in the ground floor of these new exciting things that are starting, you have great growth potential and great opportunities for the future.
Thank you, Mark. Alice and Amanda, I'm going to pose the same question to you. There's so much happening in the world right now. Where do you see the growth for the health informatics information management majors?
Well, I think some of the new technologies, telehealth has been around for a long time, but it has obviously exploded. And a piece of telehealth, how a lot of patients enter telehealth, is through patient portals. And that's something that they usually get access to through their provider. And there's a lot of opportunities for HIM professionals in that connection between the patient and the portal and other parts of the electronic health record. And then the telehealth piece obviously is a nice, you know, piece of that as well. It's hard to say what the future will hold as far as telehealth goes. There's been several holdups as to why it hasn't grown in the past. You may be aware of this, but the insurance payers have not really wanted to pay for that type of service in the past. COVID has changed a lot of things in that regard. And it looks like Congress is, you know, is really promoting telehealth for future care type visits and things like that. So there's opportunities along the way. There's going to be data created from all of these different interactions that will need to be looked at and considered, and how, you know, what's the best way to treat our patients. Where do they get the best outcomes? So HIM professionals could be looking at any of that sort of information. But what I always like to say is, wherever healthcare is given, records must be kept. And that means you have to create this data on patients. It's required by the state, it's required by the national government, that data is kept on patients when they get healthcare, when they interact with healthcare providers. So HIM professionals can kind of go in a lot of different directions because of that data that's created. They can be more patient, you know, not patient oriented, but more people oriented with some of the provider interactions. And I know one of the callers today was considering nursing school. And we actually get quite a few nurses that come into HIM either because they're not enjoying the bedside anymore, or they really didn't want to touch sick people, so to speak, after all, as a student, and realized that they wanted to change. So using that clinical information, I know we've mentioned that already, but using that clinical background in electronic systems is, believe it or not, it's a very sought after skill by a lot of electronic record systems. Our immediate market area is really kind of shifting toward the Epic electronic health record system, and that's going to provide a lot of opportunities as well. So it's like Dr. Bush said, you need to get your degree, you need to get out there, and you need to kind of get going to find the exact path for you. And you may not really know what it is while you're in school. You know, you may figure it out when you graduate, but you have to have that degree in hand and a credential, maybe if you're in the HIIM field, to kind of get you started. So what the future holds, you know, as long as people keep getting sick, unfortunately, there'll be a need for healthcare and records and all these different interactions in the data.
Keeping with that, Alice, we did get another question. You kind of touched on this. But would you say that careers that result from obtaining an HIIM degree are predominantly office jobs, or do they involve more interactions with patients, nurses, or doctors?
So there's a big trend in something called clinical documentation improvement. And that particular avenue of our field is definitely very oriented to working with clinicians. That piece of our field, and actually some of our nursing, the people who have come over from nursing to our degree, choose the clinical documentation improvement path. And that is a more clinical path. It's very oriented to the coding, but it's also making sure the documentation that is done by the providers is complete and provides an accurate picture of the patient's health picture. So it's for the coding piece, but it's also for continuity of care. So those type of opportunities are definitely more clinician interaction oriented. If you're working specifically with data, you may not work with the clinicians as much. But if you're in a facility, there's a good chance that you are going to have to work with clinicians, because you'll want to make sure, A, you understand the data that they've provided, and B, that you're giving them the kind of reports they want, and you're interacting with them with the information that you're, you know, creating based on the data that they've provided. So it kind of depends on the setting that you wind up working in. So I guess depends is my thought. And Dr. Walden, do you have some thoughts to add?
That was my big piece, is that there are a lot of different avenues, especially within HIM, but within other areas of healthcare as well with HSA, where you can focus strictly on the back room if you want to, the finance side, the administration piece. But then there's also those who are working with the patients, with the nurses, with the doctors. CDI is one of them, but it's also looking at the big picture of the structure, and it's not just administration, but how does administration work in healthcare? And it has to be a dialogue with those clinical care providers so that we get both sides of it. So I think that there are both avenues available to you depending on your type of personality and the type of job that you would want to have.
Thank you, guys. Okay, so that concludes our Q&A section. I want to thank all of the panelists for your time today, for answering these questions and going on. I'm going to give you all a minute to look at all of our contact information. Obviously, there will be more questions. This will be recorded for everyone to watch later on. And we're also going to have more webinars that dive deeper into some of the subject matters that are covered both in health information and information management and the Health Services Administration program. We'll even dive deep into some global health information, and also doing some cross-sectional step work with our public administration, the legal, and see how it all works together in healthcare. Okay, so again, thank you everyone for coming. Thank you, panelists, and we will see you in your next webinar.
Thanks. Have a great day, everybody.
Bye.
Thank you.